A 20-year-old woman comes into established care. She has some fatigue. She has a history of exercise-induced asthma. She's taking her albuterol inhaler as needed and a vitamin shot. She is vegan and does not smoke, drink, or use any drugs. She exercises regularly. She recently migrated from Thailand with her family 2 years ago and is pursuing a law degree. Vitals today include the following. Cardiopulmonary exam is unremarkable. She has pale mucous membranes, but the rest of the physical exam is normal. They give us a set of labs here. And the question is, what is the most likely etiology of this patient's anemia? So you can go ahead and pause the video to try and answer it, and then we'll go over it. Okay, so right off the bat, they told us that the patient has anemia. And I just want us to take a look back at the question and see what in the question can we use to point to the diagnosis of anemia. So first of all, she's coming in complaining of fatigue. She is vegan, and her physical exam showed pale mucous membranes. So those three kind of rank anemia as part of my differentials for this patient. And then they give us a set of labs that are basically for an anemia workup, okay? Now let's try to eliminate some of these options. B12 deficiency could be the type of anemia this patient is having because why? She's vegan, okay? B12 is gotten from animal protein, and patients that have vegan diets don't eat animal products. However, she gets a vitamin shot, which here I'm going to presume is a B12 shot because that's how most B12 is received. What else can we see here that eliminates B12 deficiency? Well, first of all, B12 deficiency is a macrocytic anemia. And here we can see the mean corpuscular volume of her red blood cells are 70, which is less than normal. Macrocytic would make the number higher, more than 100. So that rules that out for us. Okay. And then on top of that, the iron studies should be normal as well. So here we can see that ferritin levels are very low and the total iron binding capacity is on the high side of normal. So iron deficiency anemia, that could be also in our differential. She is a 20-year-old woman, and the question doesn't say, but she could be menstruating, okay? If she had heavy periods, then we'd screen her for iron deficiency anemia. But what else can we see from the question that can point to iron deficiency anemia? It says she takes a vitamin shot, but we don't know what the vitamin shot contains per se, so that doesn't give us much information. But if we look at the labs again, we can see that the anemia is microcytic. So it's smaller, so her red blood cells are smaller than usual. Also, the concentration of hemoglobin in the cells are smaller than usual, okay? And this is because we need iron to make the hemoglobin that is found in red blood cells. And if we don't have enough iron, then the mean concentration of hemoglobin is going to be lower than normal. We can also see that the red cell distribution width, so the variety of size of the red blood cell, is on the larger side, which is expected in iron deficiency anemia because some red blood cells are going to be smaller than others. So you're going to have a wide variety of sizes. One thing I also want to point out is the reticulocyte count here is 1.5%. I'm going to tell you that the normal is 2%, okay? But the main concept we need to take away from this is that the reticulocyte count is going to be decreased in iron deficiency anemia because there's not enough iron to make the red blood cells. The ferritin levels are low. Ferritin tells us about the iron stores in our body, and so it's low in this patient. The total iron binding capacity is on the higher side of normal, meaning that the amount of iron that the patient's iron binding proteins can possibly bind is large. The capacity for it to hold more iron is huge, meaning it's not holding as much iron right now. So B is the correct answer. But let's try to rule out C and D. So G6PD deficiency is a genetically inherited red blood cell deficiency. So the red blood cells don't have these enzymes, which lead them to be hemolytic. So basically rupture, especially when exposed to certain triggers or stress. Patients typically could appear a little more sicker than she is appearing here, and also could have jaundice because of the hemolysis and the release of heme from the cells, from the red blood cells. So we'll have a more hemolytic picture here. And that's not really how our patient is presenting. In addition, what else? Okay, iron levels should not be disturbed, And then thalassemia trait, which the question could also, there's something here about where she immigrated from, so from Thailand. Some question could also say that her family is originally from Thailand, or she has descendants from Southeast Asia or the Mediterranean, which are regions in the world that do have either the G6PD deficiency or thalassemia trait. And again, iron studies should not be affected in thalassemia traits, although it could give you a microcytic anemia picture, which is what we see here. So the answer here is iron deficiency anemia.